Hi everyone. I thought I'd make a video about the update with my eyes. Um, I figured just doing this would be easier for me than an email or individual phone calls. I'm just literally waking up. I haven't had like my morning mostly decaf, so I'm probably going to be sipping that while I talk. Um, so I had my follow-up neuro-ophthalmology appointment yesterday at the Flom Eye Clinic at Strong. It was a very long appointment. We were there like 2.5 hours. Um, so the appointment began with um, there's this machine where they take pictures of the inside of your eye, and it's all very trippy. Like all of these machine tests are. I make a joke while I'm there. I'm like, oh, LSD experiment, LSD. I've never taken LSD as far as I know, so I don't know. But anyway, so you look at this like star kind of configuration, and they put it like in different parts of the screen, and you have to like hold your eye, like they say okay blink, and then they say don't blink, and then this thing comes down, it takes a picture of your eye. So that takes a few minutes. So they did that first, and then they brought me back out in the waiting room, and then they brought me in again after a while to do just a general the tech did it, the like a general vision exam, a general color vision exam, um, and that was okay. And by that time, like I'd already been there an hour, I think, maybe 45 minutes, but it was already getting like long. Yeah, 45 minutes at least. So anyway, so then let's see. Then I was brought in for the peripheral vision test, which is, um, I think, no matter how good your vision is, it's an exhausting test. It's because it takes a while. Like it's not a fast one. Like the one with the stars was fast comparatively. So this test, you're on this machine again, and you have one eye covered, and you're looking at like this orangey, yellowy orangey light in the middle, and you can blink during this one, and so it's a peripheral vision test, and they're like lights blinking in different fields, and every time one blinks, you hit like a little clicker thing. Um, so the last time I did this, I knew my left eye was like, I don't want to say failed, but I knew I missed a lot with my left eye. Um, so this one takes longer, and I did like have to say to the tech, "Can we take a break?" Because I think also having the MECFS, it's also just fatiguing to do it. But anyways, so we did the right eye first, which is my better eye, um, and I even had to take a little break during that. So the the little lights that flash in the periphery, some of them are brighter than others, and that's kind of tricky. And then the other problem for me personally is when you stare at this yellowish light, you get like a ghost image, like that's how, that's just when things are sort of double vision, but not really. It's like when you stare at something like a light and you start, anyway, I think you know what I mean. So so that's what's also really hard about it is that the lights in the periphery, some are very bright, but others are very dim. And that's how they're testing the acuity. So then they did the left eye, and same thing, and I knew I was missing a lot. and I actually felt like it was worse this time. So, I even said to the tech, is this one worse? And they're not allowed to tell me. The doctor has to tell me. But I felt like, I don't know, I just had a feeling it was worse this time than the first time I did the test. So if you remember from my email, the first time I did the peripheral vision test, it came out that I lost peripheral vision here. So inside, like from, let's say, about, the tear duct to about the lower center. Like, I mean, it's not like maybe 1/16 to 1/18 of that diagonal. That's the best way I can describe it without actually having an image to show you. Um, so got through that, and the tech even said, yeah, patients really don't like this one. It's really hard, for everybody. So if you ever have to do that test, just know that you can ask the tech to slow it down, because I was starting to get like repetitive motion, a little pain, because it was going pretty fast, and I asked them to slow it down on it when I did it a couple of months ago. So then they slowed it down. I said I need it slowed down for the left eye, so she did. So you can have them slow it down, and you can also take breaks. You just have to tell them, can I take a break? And then they pause the machine. And then you just kind of blink and look around for a minute or two, whatever. So that was done. And then they brought me into the exam room again. And then I had the meeting with the doctor. And, I told the doctor that she said, so how are things? And I said, well, I noticed like in the past, I mean, I didn't write it down, but like basically in the past 4 to 6 weeks, that my left eye it seemed like it was getting better. So it would, like, let's say I would wake up in the morning, not today, like today it's bad. Like, some days I wake up in the morning and it feels like it's perfectly fine, but then an hour or two go by and it's really messed up again. And she said, when is it worse? When is it better? I'm like, there's no rhyme or reason. It's just like whenever. Like today I woke up and it's completely bad again, and it might be better in 4 hours. It's just so. So she showed me So she said, well, she said, as I figured, the edema has healed, so there's an improvement. It looked like, she's saying like it's healed, and I could see from like what was displayed on the computer, like it's not completely healed, but I think it's within a normal range now. Like the right eye, I think from the computer it was like it showed like a green box, which I think meant like normal. I don't know, because everything, it was so overwhelming. And the left eye, it looked like there was like yellow, like, so it means like yield versus stop. I think that's what I saw, how the interpretation goes. So she said, as I predicted, it's healing, and so I was diagnosed. So the thing with the peripheral vision on my left eye this time, so when I looked at the results of the test, I still had the peripheral vision loss in that section of the eye. However, while I was doing that test, I said to I was saying, I think my left eye has gotten worse. So, and it's hard because of this, it was very fatiguing, and it's also like this ghost image, and some of the lights are so low. Anyway, it looked like there was a more diffuse area of vision loss compared to the first one that I did, a couple of months ago, whenever it was, or whenever it was in May, um, like an like another area that I looked at. She didn't say you have vision loss here, but they show you, and on the screen there was like an area diffused, like where I quote unquote failed the test, but we didn't really talk about it. So the good news is, my central vision is intact. I don't have, apparently I don't have like any obstructions in my central vision, they call it. Um, at this point, it's not known if this is permanent or not. Um, I think the likelihood is that it's permanent because from so the diagnosis finally, is called, let me pull it up, non-arteritic 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 anterior, so means front, ischemic optic neuropathy, and they call it NAION, NAION. So I'll just quickly read it, and then I'll attach the link in the email. So non-arteritic anterior ischemic optic neuropathy, NAION, refers to the loss of blood flow to the optic nerve, which the cable that connects the eye to the brain. The condition typically causes sudden vision loss in one eye without any pain. I did have some pain. In many cases, the patient notices significant loss of vision in one eye immediately upon waking in the morning. The visual loss typically remains fairly stable without getting markedly better or worse once it has occurred. So what's a little unclear to me right now, so I asked her, is there any chance that it'll improve? And she said, well, if it does, it'll be within the first 6 months. I think there's, I mean, I just have to assume this is permanent. And it's difficult because I do notice a change. My left eye function is definitely different than it was like 3 months ago. And also the sensation of swelling and, where I feel like it's normal and then all of a sudden it's like, I don't quite know how to say it. It's like, it's not like it's completely obstructed. That it's very difficult for me to explain it. It feels like, the best way I can explain it is it almost feels like, so I have like these moments where it's feeling normal, and then all of a sudden when it starts getting bad, it feels like it's swollen, like it feels like something is swollen, and then it kind of looks, or I imagine it feels like maybe, and only the left eye when this happens, like when you open your eyes underwater, not the stinging feeling, but just like the visual aspect of that. That's the closest thing I can say it's like. But then when I like shut my eye, I can still see, I still have that clear center vision. So it's just very weird. Um, so so a friend of mine asked how is it affecting my eyesight, and that's the thing, like if I'm on the computer, and I do a lot on the computer because it's just what I do, and if I'm scrolling and I'm fine and then it starts acting up, yeah, there's a big change. It's difficult for me to read. um yeah, it's harder for me to concentrate. There's more, there's a greater sensation of eye strain, I guess. But yeah, like when it feels like it's okay, like I have less problems on the computer, but then when it's like it is now, like when it feels like something is swollen or that, you know, whatever. Um, I mean, it's not inflammatory, it's ischemic. So, but it feels inflamed. It feels like there's inflammation. So, right now, I would say, if I was trying to read a lot on the computer, it would be harder for my left eye to want to do that. That's just an example. And then if I'm in the kitchen doing something, sometimes I do have to like tilt my head in a, if I'm looking for something. More often now, I find I have to turn the light on, or like tilt my head and look at different angles. It's subtle. I mean, like 6 weeks ago, I felt like I was doing that more, but I still have to do it sometimes. Like, and my kitchen isn't always like super tidy, so if I misplace my cup, and I'm like, okay, where did I put my cup? And then, um, so it's not like a huge deal, but it's just it's just a change. Um, and they did a vision test, and that was adequate. So yeah, it's like this peripheral vision, and the peripheral vision isn't just like what you see out of the far corner of your eye. It's also what you see like in the mid corner of your eye, or on the top or the bottom. I mean, this is all periphery. So for me, the major area of vision loss for now, hopefully, I mean, I'm hoping it'll heal, but I'm not getting my hopes up. So this is the area. So that's my diagnosis. I know this video is kind of long, but I wanted to explain everything to like a group of people so I don't have to explain everything on a phone call, because it's very involved. So the doctor also said that I have this, when you read the link, so I have, and it's something you're born with. My optic nerve, the nerve cells or fibers, they're like densely packed. Like they're dense. Like you can read about it more if you look up the condition. So the nerve cells are they're like tight together, and if you are born with that, you are more prone to this condition, to this event. I should say it's an event, because so also now, okay, so now what I have to do is, and I don't think I have this, so the next thing is like to talk to my primary care doctor, well, I have a nurse practitioner, about doing a sleep apnea test, because this is a microvascular condition. Like, it's a microvascular event. So I did a little bit of reading after the appointment yesterday, and yeah, I mean, you can start taking aspirin and things like that. I am going to start trying nattokinase. It's this supplement which I learned about in the last couple of years, and it can act as a blood thinner. And because the thing is, so now that I've had this in the left eye, and I do have, we're all hoping that in the 6 months I'll regain my vision. I'm not optimistic. I'm not. And I'm not saying that to, what do you call it? I forgot the expression, like, not test fate. There's a different expression. So anyway, so there's no cure, there's no surgery, there's no medicine you can take. The only thing you can do is treat this microvascular problem. So like not enough blood is getting into the optic nerve, and not enough blood is, getting into my eyes. I think basically, so I watched one video, and the person in the video called it a stroke, and I guess the word ischemia means, I guess that's what it means. I didn't ask her when I was there, was this a stroke in my eye? But I think ischemia is that's what it means. Anyway, so I know I'm a little bit all over the place. So because it's a microvascular condition, they want me to, she said, do a sleep apnea test. And I don't really want to do that. I don't think I have it. I just don't have the risk factors for it. Um, I don't think I have that. Um, it's like this nerve, the nerves being so compacted, in the optic nerve. Like that's the predisposition. And the other predisposition is like other cardiovascular risk factors. Like, are you a smoker? Are you diabetic? Do you have high cholesterol? Like, it's all those risk factors that are associated, like, with heart disease and stroke. So anyway, I do have an appointment with the nurse practitioner sometime this month. I didn't write down the date. So we'll talk about this, and I've taken the nattokinase before. Obviously, I have it on hand. So I'm going to start taking this because so now when you read the article, now that I've had this in my left eye, I have a 30% chance of it happening in my right eye, and that's really high. And it's really high considering the unpredictability of the potential vision loss and where it will occur in the eye. I think from the very little that I read yesterday, because I was really tired when I got home, so I think it's usually like in the area where it happened to me, like in the lower part of the eye. But there's scarring, you know, the the lens or whatever, whatever's happening in the eye anatomy, which I'm not, well versed in, like there's scarring. Like, it's like when yeah, it's like ischemia means like a stroke, I guess, and there's going to be scarring. Um, and the doctor, she said that. It's like you have a scar, that's what it is, the vision loss. So only time will tell. Um, so yeah, so the only prevention is like, not like everything you would do to prevent heart disease and stroke. I mean, that's basically it. And the nattokinase, there's other kinases. There's lumbrokinase, and I think it's called subtatrokinase. There are three of them. It's made from like soy, and it can be used like as a blood thinner. And I got this to experiment with it because some people with ME/CFS have microclotting. I've never been tested for microclotting. And this is like a completely different subject. Like, this is completely different from the eye thing. But so I can't be tested for microclotting. It's not something you can just do at the lab. This is like highly specialized blood testing. But there are people with ME/CFS who have microclotting. They've been tested. So I thought I would get this stuff like a while ago, like in the past year and a half. I haven't used it a lot, but I thought I would experiment with it. Um, so I'm going to start taking this. We have a train track out there. I'm going to start taking this, um, sort of, as a blood thinner. And my doctor's office knows that I have this, and I even talked to them about it. So the only thing is I can't take it when my Ritalin is active because it enhances the effects of the Ritalin. So I'll be having to take this at night, and you take it on an empty stomach. Um, Empty stomach and an hour before a meal. So that's kind of like, you know what I'm gonna try, just because it's pretty benign for now. I'd rather do this than aspirin at the moment. So nobody told me to take anything. This is just, when you hear about vascular, and then you read a little bit about the NAION condition, and they say sometimes people take an aspirin a day to prevent the other eye from having this happen. So this has been very long, but I wanted to be as thorough as I could, because I know a few people will want to talk to me about it and know more details, and I just figure I want to just see if I can cover as many bases in a video. This has been very long. Yeah, I'm gonna have to split this video up because I have a upload limit on YouTube. So thank you so much for watching this and listening to it all. I mean, I think it goes without saying that this would be very long because it is complex as far as what causes it. There is no cure, there's no treatment, there's no intervention. The only thing I can do is, not hope it doesn't happen to my right eye, and hope that maybe I'll regain vision again, and, that peripheral vision in my left eye. So the treatment plan, so to speak, is, I'm putting in quotes because there is no treatment, is I have a 3-month follow-up with a neuro-ophthalmologist, and they'll probably do all these tests all over again. It'll probably be another very long visit because this is, my eye has been damaged. And then the follow-up with the nurse practitioner, the primary care nurse practitioner, to talk about sleep apnea test, which I really don't think I have, but I'll talk to her about it. And I mean, the clustered, the dense nerves is a predisposing factor, so it makes sense that it would be that. That's it, and I'm trying to think, is there anything else? Yeah, I mean, here's the thing, like, if you have cardiovascular, so it might be, here's the thing, if you're younger than me, or any age, it might be worth asking your doctor, your eye doctor, next time you go for your yearly exam, ask them, are my optic nerve cells dense? Am I predisposed for NAION? And you're predisposed for it if you have cardiovascular issues like smoking, high cholesterol, sleep apnea. What did I miss one? I don't know, high blood pressure maybe. But I would ask, when you see your eye doctor, do I have these dense nerve cells, that would predispose me? Because if you know that, then you can say, okay, if I have this and it's a microvascular issue that could happen. I'm not, not everybody with these dense nerves is going to get this. But that's the predisposition. And once you have that, then you can say, okay, I need to make sure I don't have sleep apnea, that I have my cholesterol is in check, all these other vascular things, probably quit smoking. So yeah, I mean, I don't know anybody else in my family who's had this. But, I'm the family, I don't want to say, I almost said weirdo. It doesn't matter. So I'm the only one in my family who even has ME/CFS. I mean, so whatever happened with my genetics and my environment and, it's all combined. Whatever happened to me, it's just part of my journey. So that's the update about my eye. it's been a lot. It's been a lot. And so there's a low, you'll read in the thing also, there's a low likelihood that it'll happen again in my left eye. Because I think now that there's been ischemia, some of those dense nerves may have been destroyed or something. I'd have to read more about it. I think that's how it goes. Like, if they're destroyed, then now there's more room, or I don't know. I'm just making it up at this point because I was trying to read stuff last night when I was so tired. But it's lower likelihood that it'll happen in the left eye again. There's a 30% chance it can happen in the right eye. And so I'm going to start taking the nattokinase because um, that's all I've got right now. And I don't want to. Yeah. So the doctor said, like, there's no cure, there's nothing you can do about it. Um, but, I did read about the aspirin. And then you can even Google, like, I found an article about nattokinase and diabetic retinopathy or something like that. And there seems to be like a positive thing around. I mean, it's all very anecdotal and not huge experiments, so, but it's a blood thinner. And we'll see. This is just today. Things can change. I know this was really long, but it's a big deal, it's a big deal. And I also wanted to explain it all because if you have the risk factors, you may want to start addressing that. So yeah, so next time you're at your eye doctor, ask them, are my the cells in my optic nerve, are they dense? And they'll know what NAION is. You can just say, I want to know if I have a predisposition for NAION. They'll know exactly what you're talking about. If you're going to the ophthalmologist, they will know exactly what you're talking about. This is not like a mystery condition. So yeah, I would just find out because if you can prevent it, prevent it. Thank you so much for watching. Like I said, this is in lieu of like multiple phone conversations where I'd have to explain it all. So that's why it was kind of long. And yeah. Bye.